Hello and welcome back. Today we're talking about international patient safety goals. They're one of the most crucial steps to get our foot in the door. So without further ado, international patient safety goals are. First one is identify patient correctly. And how we do that by writing down their full name and having a unique medical number on the ID wristband and on the label patient stickers on the file. We do that with patients who is unconscious or their triage level is 4 or 5. On the other hand, we don't do that with patients who just go back and forth out of clinics because they are simply conscious and they can identify themselves. Secondly, improve effective communication simply by improving verbal or telephone communication, either for reporting crucial lab results that's going to affect the patient's intervention, or just in case we need to give an immediate medication. As nurses, we all know that we cannot give medication without an order and without that order to be signed by the doctor giving that medication. So just in some cases there is exceptions. In the ER, where there is a code blue, we don't have time for that. Also in the OR, in the operation room, we are in the sterile feed. We just can't break out the sterile feed for having a medication order that need to be administered to be signed. And in ICU, just a really small hint for nurses, we can't give medication orders by just a telephone, or in these cases it's going to be just one dose. There are some medications we just can't give, but when we give it, the receiving nurse should do 3 things. The receiving nurse should write down the order, then read back the order to the doctor, then the doctor must confirm the order. Just 3 steps, the golden rule: write down, read back, confirm. And in that same shift, the doctor that has been giving the order must sign the medication order that he had been given. The third one is improving the safety of high alert medications. Improving the safety of high alert medication is achieved by location, because high alert medication, concentrated electrolytes, and lookalike and satellite medications cannot be provided and available in every ward in the hospital. This is the first step. The second step is by labeling. We label these medication. It's easy to understand and identify because it got colors. The red one is for high alert medications such as insulin or heparin. The yellow one is for concentrated electrolytes such as magnesium, calcium, sodium. And the yellow, we did the yellow one. Okay, the light blue one is for lookalike sound-alike medication like hydrazine and hydroxyzine. They are lookalike sound-alike medications. And there is the orange one is also for high alert medications, but they must be diluted before use. There is something called 10 rights of medication administration: right patient, right medication, right time, right dose, right route, right education, right assessment, right evaluation, right documentation, and right to refuse. The fourth one is ensure correct patient, correct site, correct patient surgery. This is easily done by scheduling, post-operative verification, site marketing, and the process of signing upon the arrival of the patient. Timeout within the operating room while every member of the surgery team is present before any incision, and sign out before the patient leaves the post-anesthesia care unit. And the fifth goal is reduce the risk of healthcare associated infections, and this is precisely done by really accurate hand hygiene and knowing the 5 moments of hand hygiene, which they are before touching the patient, after touching the patient, before doing any procedure with the patient, after being exposed to bodily fluids, and after touching patient surroundings. The final goal of international patient safety goals is reduce the risk of patient harm result from falls. We do that by the process of fall risk assessment, then reassessment, then taking precautions. Bear in mind, we do take precautions without full risk assessment. So what are the precautions that we use? We use wheelchairs, we use side rails, we usually rise the side rails, we use a full risk wristband on the patient. We also use the F sign on the doors, and we got to know that if that patient accidentally have fallen, the nurse should assess that patient immediately. Then we need to document what happened on the OVR form, which is occurrence variance form or report, and we need to report to the doctor immediately. And if it's possible to transport that patient near to that nurse station, is going to be great for close-up from the nurse to the patient. To sum up the video, we talked about international patient safety goals: identify patient correctly, improve effective communication, ensure correct patient, correct site, correct patient surgery, improve the safety of high alert medication, reduce the risk of healthcare associated infections, reduce the risk of harm result from falls. And we talked in details about every one of them. Also, one of our rules to be, as nurses, to be an advocate. Being an advocate is just having the first priority for us is patient safety. Until seeing you in the next video, be safe and be healthy. Thank you.